Good afternoon, deeply respected jury. My name is Samir, and my colleague is Roder Saido. We are medical students of fifth course at International Faculty of Dnipropetrovsk Medical Academy. Our supervisor is Maria Rokotova, Professor Assistant of Endocrinology Department. Our topic, nutritional status, risk of diabetes mellitus type 2, and markers of metabolic syndrome among medical students. The statistics of World Health Organization show the increased quantity of cases of CVD, cardiovascular diseases, and diabetes mellitus type 2 every year, which associated with metabolic syndrome. Cardiovascular disease continued to be the leading cause of death worldwide. Abdominal obesity is the main marker of metabolic syndrome and associated with next major pathologies: insulin resistance, diabetes mellitus type 2, CVD, glomerulopathy. Let's notice the glomerulopathy is the new term of nephropathy related to obesity in patients, but without the hypertension or diabetes mellitus. Currently, the problem of obesity and diabetes mellitus type 2 is also very relevant due to pandemic of COVID-19 nowadays. Obesity, diabetes mellitus type 2, and CVD in these patients are underlying conditions of development and mortality from COVID-19. The aim of our study is to investigate the features of nutritional status, the risk factors of development, type 2 diabetes mellitus, and also early markers of metabolic syndrome among medical students. So, the design. Design of our study consists of two stages. The first stage of investigating the features of nutrition status and the risk factors of developing and leading to diabetes mellitus type 2. So we examined 200 medical students from first to sixth course. There were Ukrainian students, 140, foreign students, which from Arabic nation, and Indians were 60 students. At the second stage of our investigation, the early markers of metabolic syndrome, we taken away from only Ukrainian students, 43 students in general, and divided for another two groups. First main group consists of 31 students with abdominal obesity from 1 to 3rd degree, and the second group was only for control, healthy students. According to the goals of the study, the research method was used at first stage: physical examination, anthropometry, tonometry, anamnesis assigning, including data on the risk of development diabetes mellitus type 2 for Fenrisk scale. And the second stage of study included methods to characterize the state of carbohydrate metabolism, HUMA-IR, insulin resistant, blood lipid spectrum, level of albumin in urine, GFR, and leptin resistance. According to measuring the BMI of all students, Ukrainians and foreign, the average of overweight and abdominal obesity 1 to 3rd degree tend to be for the foreign student more than the Ukrainian. As shown in the graph, studying prevalence of risk factor diabetes mellitus type 2, we found that family heredity of diabetes mellitus type 2 was smoking, alcohol consumption, fast food, hypertension, overweight, and risk of development diabetes mellitus type 2. This indicator it tends to be the highest among the foreign students than the Ukrainian. Low physical activity prevailed among Ukrainian students. Stress factor, as you see in the graph, was the highest for both students, Ukrainians and foreign. And the main reason of these high results, especially fast food consumption. In the next slide, I will be showing the reasons. Here. Most of students answered because they are quick, too busy to cook, and convenient. This could be to different reasons. As we all know, as a student, our responsibilities and the rush in time, which causing of risk factors. The second stage was performed only with the Ukrainian students, which had obesity from first to third degree, as we mentioned before. And according to WHO, World Health Organization, without diabetes mellitus and hypertension. Patients of two groups were homogeneous in age and gender. Analysis results, we found that GFR in first group was increased at 78%, the increased GFR on the graph, the lower right. Microalbuminuria was detected only at 10% of students. Although microalbuminuria and hyperfiltration are indicator of early glomerular renal dysfunction. It is generally known that microalbuminuria is early marker of endothelial dysfunction as well, which associated with cardiovascular disease and chronic kidney disease. From previous investigations, it's shown the process of exacerbating the urine albumin and increased mortality from chronic kidney disease, 19.2% per year. In 2001, the term obesity associated nephro or glomerulopathy was introduced, but there is no classification, markers of diagnostic and algorithm of treatment in patients with obesity without diabetes mellitus and hypertension. Okay, this slide shows Moynihan's classification, 5 stages of diabetic nephropathy. We suggest that in the future, the classification of obesity-associated nephropathy will be similar to this classification. In the example of this classification, students were placed from first and second stage, functional stages, to the third stage, initially nephropathy with hyperfiltration and microalbuminuria. It is shown that students have early glomerular renal dysfunction. According to prognosis of chronic kidney disease by Digo 2012, medical students with obesity have stages indicating a white circle or blue circle in description. This was the average of our students in this management, which is G1 for glomerular filtration rate stage, and A1, A2 of albuminuria that mark the early stages of chronic kidney disease. The results show that 55% of students have pre-diabetics, about 87% hyperinsulinemia, and almost all participants have insulin resistance. Profile lipid. According to our result, about 50% of students have dyslipidemia, especially high level of triglyceride and low level of HDL. Relation analysis showed a moderate dependence between urine albumin and risk factor of metabolic disorder, such as smoking, glucose fasting, and after loading, total cholesterol, triglyceride, high-density lipoproteins. Predictive role plays insulin and leptin resistance. Even though medical students were aware and familiar with the risk factors of development diabetes mellitus type 2 and CVD, as well as complication of obesity and metabolic syndrome, which is the core of future complications such as hypertension, diabetes type 2, and atherosclerosis. We found them in a risk of developing metabolic disorder and marker of early renal dysfunction among the medical students. This group of medical students with abdominal obesity from 1st to 3rd degree, just to notice. First conclusions. For the first stage, most Ukrainian and foreign medical students have various risk factors of development diabetes mellitus type 2. Among the risks of developing diabetes mellitus are overweight and obesity as a result of violation of nutritional status. As we mentioned, alcohol consumption, smoking, fast food, stress, and low physical activity. For the second stage of the investigation, among Ukrainian students, we found hyperlipidemia, dyslipidemia, pre-diabetic hyperinsulinemia, and insulin resistance. Despite the detection of albuminuria in only 10% of Ukrainian medical students with abdominal obesity, this marker already indicates the early stage of glomerular kidney damage in patients with abdominal obesity and the presence of endothelial dysfunction in young patients. Predictive role of insulin resistance, hyperlipidemia, smoking, dyslipidemia, pre-diabetic for increasing urine albumin level in persons with abdominal obesity was established. It is determined the importance of identification young patients with high risk of cardiovascular and renal complications to prescribe of adequate pathogenic therapy. Now, prevent the development of diabetes mellitus type 2, it is necessary to conduct a survey of medical students on the risk scale of diabetes mellitus Findus score, identify symptoms of stress, and give recommendation of lifestyle modification for the students. The logotype of our academy, medical academy, is like displays one of the principles of treating obesity to be always in the moment. Thank you for your attention.
Excuse me, can I ask one question? I had some troubles with internet connection.
Oh, okay, sure, of course.
Yes, of course.
Please.
Thank you. What do you think? Is there an influence of eating traditional national food or Ukrainian and fast food eaten by foreign students? Could it influence for results of your study?
Of course, because our study is based on the risk factors, and to consume fast food is one of the main risk factors for metabolic syndrome, which can lead for different disorders, such as diabetes mellitus in the future, type 2, to increase insulin resistance.
Okay, thank you.
You're welcome. You as well.
Samir, may I ask you? Hello?
Yes, please.
How do you think, wouldn't it not better to investigate, for example, Indian students separately, taking into account high prevalence of diabetes mellitus in India, for example? It seems to me it could be, it could lead to, it could lead to new findings in this specific ethnicity. For example, you didn't investigate Africans at all, and investigate combined group Indians and Arabian students. Do you plan for future, for example, investigate it separately?
Yes, actually, this investigation, especially the second stage of our investigation, was only for Ukrainian students. And later on, we have already the plan to investigate and repeat the same analysis for foreign students. Later on, we can concentrate only on foreigners. So, as you said, we can also, with the help of other nations, as Africans, Indians, Arabic, and if there's any other nation in our academy, we can use their service.
Yes, thank you.
Thank you.
May I ask you one question?
Of course.
How do you think, why there is such big difference in percentage of smoking between Ukrainian students and foreign students?
Okay, it's a really good question. Actually, I was discussing this question also with my supervisor. I think because we are like students are foreigners, and let's not forget their age. They are too young. Probably not all of them know how to cook or eat healthy food. Let's start from that food as a risk factor. So they choose the fast way of eating. And the other reason possible that the rush in time and as a medical student and the stress they live in it. So they tend to smoke or consume some alcohol, and let's not forget they are living alone in a foreign country for them. So all these possibilities could lead for this big differences between Ukrainians and foreign students.
Okay, thank you.
Hello.
Hi.
Hi. Like in some students, you make early diagnosis, and how will you what you will suggest them to prevent the further complications? Because they are still having the same situation, same environment, same stress level, maybe same diet even. What will be your like suggestion for having some preventions or?
I think medical students are well known about the situation and the risk factors. The thing I think about, like my personal thinking of it, from academy must be some advising or some methods to use with the student just to, first of all, stress what the highest among both students. So we must manage this one as a first pose. And later on, they must control themselves and know how to have a lifestyle, of a healthy lifestyle.
Okay,
This is the
thank
only
you.
management. You're welcome. Thank you.
So thank you very much for your presentation.
Thank you, everyone.